This may be a funny video, shh, don't tell your husband, but basically I really want you to understand what I'm talking about. I've done a podcast in the past on this and I want to give you an updated discussion. There's not much to update, but I think it's nice to be able to shoot these and not just in an audio format where you can see my face and hear what I think about this. So this is something very, very common. I had a lady that told me recently, my husband, he's pretty unique. He doesn't like me to do anything for my face. And I said, well, I hate to tell you this, that's not unique. Every single husband will, by mouth, say that he doesn't want you to do something. I had another lady who was actually quite smart not to tell her husband or say anything about it, and I'll talk to you about what that means. She's from Houston, and I've been doing her for many, many years, and her husband one day said to her, "You have the weirdest genes because every year you get younger and I get older. I don't know what's going on." And that's unfortunately, or the truth of it, is where things need. That may be my best recommendation, is not to talk about too much of what you do. Men want you to look great. There's an audiobook I listened to. It was not called Men Are From Mars and Women Are From Venus or whatever that book is. It was just talking about how men sort of see things. They want women to look great, but they don't want to pay for it. They don't want to know about it. They don't want to know about your monthly cycle. They don't want to know about how you did your hair for 2 hours. And they may not even see a difference, to be honest with you. There's sort of a blindness to seeing what things are there. Recently, I did a hair transplant for a gentleman, and he has a really nice looking wife who has been really distorted by fillers. And it's very sad because she has great facial features and it's been really destroyed. And she said, he doesn't want me to do anything because he doesn't want me to look unnatural. But he can't see that she already looks very unnatural, and he's afraid that I'm going to do something to make her look unnatural. So if you haven't seen my video about the standard of naturalness is, your standard of natural is too low, I encourage you to watch that, because I'm not going to make you fake. I hate fake. I cannot stand it. But I will help erase it. But this is the problem, is men they will say, I don't want you to look fake. And they sometimes don't even see that there are elements of fakeness that I need to fix. This is just their lip service to it. So a few things are important. I'll tell you another story too. I had a lady that I did a facelift on, and her husband came to pick her up, and she told him that she had a facial done. So I think it's pretty funny because men don't really understand all this. So men want women to look great. They simply don't want to know about it. And so a few things. First of all, I hear at the end of a consultation, the woman says to me, I'm going to go home and ask my husband. It won't be done. If you go ask your husband, it's very rare. I would say probably in the order of less than 5% will a guy says, honey, do whatever you want. There are some. Husbands are very supportive of that. But if you ask your husband, do you think I should have, fill in the blank, if it's Botox, fillers, facelift, fat grafting, hair transplant, whatever it may be, I can almost guarantee he's going to say, no, don't do it. And here's the problem with human nature is when you declare a no, and you say, no, I don't think you should have it. No, the problem is you're screwed at that point, because when you ask the question and told him that, look, hey, this is, I'm asking, should I have it? You're opening yourself up for a problem, because if you say, well, I'm going to do it anyways, well, why'd you ask me? Well, now I've also declared that I don't want you to do it, and you're still doing it. So how do you approach the situation then if your husband's either A, paying for it, or your husband needs to know about it, or your husband is part of this whole thing, or whatever it may be? So it is a difficult situation. First of all, I wouldn't ask. I wouldn't directly ask in that way. The way that I would phrase it is the following. So first I would say, let me take a step back and say, I'll tell you another story, and then I'll give a context to understand how I'm going to respond here. So an anesthesiologist told me that she said her husband, for my, I think it was 20th wedding anniversary, whatever you do, do not get me a car, get me a ring. I want a ring. The husband got her a car, and he was flabbergasted and shocked that she did not like the car. And he says, well, look, I got a convertible. You like convertibles. Yeah, I spent a lot of money on this. It's something that I thought you would like, and I can't believe you're telling me you don't like it. And the reason is she doesn't like cars, and he can't understand that. So the language of men is cars and, watches or sports, and that may be three things that you don't care about. So it's very difficult when that language doesn't translate. So how do you approach it? this is something that means a lot. So what I would say is a few things. First, don't ask before you tell. First I would say diminish what you tell. But if you've got to tell, because I'm not trying to ruin a relationship by you saying, look, I'm never going to tell my husband anything. So if it is something where, some women, they do it where the husband's out of the town and they just don't say anything. But if you've got to disclose it, the way that I would disclose it to him is as follows. Honey, I found a doctor who does very natural work. I hate unnatural. He hates it as well. This is something that means a lot to me. It may not mean a lot to you, and I'm not doing it for you. I'm doing it for me because I don't feel my best. You may feel that spending money on cars is important or on watches. To me, this is something that means a lot to me. It's taken part of my identity away. I look in the mirror. It's not the same person that I feel I am. I'm a very vibrant human being, and when I look at that, I don't like it. Here are some photos. So the other thing I do now sometimes, and remind me if I forget to do this, is I take screenshots of my photos with your phone and just show it to him. So look, his patients don't look fake. They look natural. And he does very safe work. I'd be more than happy if you have a question to go in and have a consult with him, which is something I do welcome. So I would say if it requires a surgery and you really don't want to hide it from him, the way I would approach is say, don't ask if you can do it. Just say, look, these are things that are important for me. So this is something that I really need to do for me. It's something that it will make me feel better about who I am. And so then this is how I would approach it rather than saying, first out of your mouth, what do you think? Do you think I should have this done? The second thing, when it comes to small procedures, a white lie goes a long way. Most men do not like even the idea of Botox, fillers, whatever it may be. Whatever you can do for the small things, if you can get away with a white lie and not even talk about it, if you don't feel comfortable doing that with a fat graft or whatever it may be, then if for the small things, Botox, fillers, whatever it may be, I hate to say you may not even want to tell your husband you're doing it. It's just an easier exit. You say, well, what if I go home, I have some bruising and some swelling and some little bit of bumps. Say you had a facial. Say you went to the esthetician with the spa and they're doing a deep clean on your skin. Most men have no clue, okay? They really don't have a clue. I know it's a terrible thing to say all these things because I'm a guy, I'm a husband. Now, of course, I do my wife because I trust my hands. I work on my wife's face all the time, and I love one scene. It was funny. One of our mutual friends, my wife and me, and she says, she comes in for Botox therapies, and she said, whatever you do, don't do my lips because they're all fake. I said, you just had lunch with my wife. Do you think her lips look fake? She was flabbergasted. She couldn't tell they were done. I said, of course you can't tell because I don't do fake work. So understand that there are many ways to approach it, but anything you can minimize. Like the word facelift is a daunting one for a guy to hear. You may not want to talk about neck lift. You say a small little lift on the side. As much as you can make things diminutive for your husband, the better it is. You don't say, I'm going to do a brow lift, eyelid, fat graft. You may want to use the words, he's going to add just a little bit of volume right here, maybe take a little bit of skin on the edge. You can see how natural his, let me show you how natural his results are. He's going to do just a little bit of a micro tuck up there. And those are the small things that I would encourage you, the language I would encourage you to use so that your husband doesn't get scared or shocked. And when it comes to small things, I jokingly say I'm sort of like a high-priced escort in the sense that no one wants to know. So if I'm at a restaurant, I don't say hi to you because I don't want anyone to, people don't want to know who I am or whatever it may be. So definitely in terms of what you want to tell your husband, diminish it to the best of your ability. Try to mitigate it. And if it's small therapies in the office, you may not even want to disclose it or use the spa therapy. I went to get some rough texture treatments. Trust me, men don't want to know. They don't want to know too much. They want to know as little as possible, and that's the best way you can to work this relationship with that husband of yours.